Good morning. Hi. We are here, a little damp around the edges, but I'm glad you're here. We're welcoming our generosity recipient speaker this morning. And let me first introduce me. I'm Lynn Walters, co-chair of the Outreach Committee. And our speaker is Carly, I'm going to get it right, Wignaraja. And she is the CEO of Tulsa CARES, which provides many services in our community for those with HIV and hepatitis C. So we're looking forward to hearing about their mission and the activities that they provide for these folks. So welcome, Carly Wignaraja. Did I get it?
Good morning. Thank you all so much for being here and for having me. I love meeting new people and getting to share a little bit about Tulsa CARES with the community, especially those that may have no idea who Tulsa CARES is and kind of the population we serve. So we were founded in 1991 during a very dark time, kind of the darkest days of the HIV/AIDS epidemic. A small group of people really rallied around those fighting this disease and really just wanted to provide dignity in their death. Today, 30 plus years later, it's a very different organization. Our clients are thriving, but here to just share a little bit about what we do and our mission. Make sure these are advancing. So yes, we are serving HIV primarily, and then in 2018, we started serving those living with hepatitis C. And really, our kind of model of care is really removing the barriers that would prevent people from getting medical services and treatment. We're dealing with a very socially vulnerable, stigmatized, often marginalized population, and so it's a little bit different. They're dealing, yes, with the HIV and the hepatitis C, but they're also dealing with things like food insecurity, homelessness, mental health issues, substance abuse issues, things like that. And so we recognize that, like, if you are on the streets or you're hungry, you may not care about your HIV, and you're certainly not going to be adherent to your treatment and getting the medical care that you need to stay virally suppressed and healthy. And so we're really removing those barriers and providing tailored, dignified care for those who really deserve it most. So our overarching goals, like I said, we're linking people to care and treatment. We're addressing those barriers to care, and really we're focused on improved health outcomes and improved quality of life. It's not just about health, it's about feeling good about yourself and living the fullest, healthiest life that you possibly can. And fortunately, with the treatment advancements today and the fact that hepatitis C is now curable, our clients are living really full, thriving lives. We also recognize, though, that stigma still exists, and I don't have to tell you this, but living in Oklahoma, our clients still face a lot of discrimination. They have community that has abandoned them, and so for those clients, Tulsa CARES often is a very safe place where they can feel at home and they can be themselves. So our model of care is, as I mentioned, very comprehensive, and I know this is hard to see, but these are kind of all the things that we're offering at our agency, everything from care coordination, food, housing, transportation, prescription assistance, medical care, you name it, we're often doing it all in one building, so it's kind of a one-stop shop. We're located at 11th and Harvard, so we're on a bus route in a fairly accessible part of town. We do serve the 23 counties of northeastern Oklahoma, so we do have rural outreach. Rural is obviously a harder population to serve, and they've kind of got an additional layer often of stigma and other issues that we're working with there. But the vast majority of the clients we serve live in the Tulsa MSA. We serve about 1,100 clients a year. About 900 of those are people living with HIV, and then the other 200 are people living with hepatitis C. And then we, of course, serve their families or their identified families, although most of our clients are single-family households. So we're also dealing with just kind of some isolation, and certainly COVID did not help that for anyone. So we're really, again, trying to be that family for them, that safe place. So I'll go a little bit into each program. Care coordination is kind of the overarching umbrella of the work that we do. You're assigned a case manager when you come to Tulsa CARES, and your care coordinator is kind of your main point of contact, your advocate, the person that's referring you to programs. You can kind of call them up anytime. We have care coordinators that might go to the hospital and sit with you while you're getting a colonoscopy, or they're taking you to the DMV so you can get a new license. So a lot of times there's these other barriers, these life skills that some of our clients may need support with, and so that care coordinator is kind of their buddy in all the ways. We're really trying to not just give Band-Aids to people, but empower them and give them the life skills that they need to thrive and kind of do some of this on their own. The support is collaborative. Everyone has a unique, client-driven, kind of goal-oriented plan. Your care might look different than my care, and your goals might look different than my goals, and so we're really trying to support the clients individually and uniquely, and again, trying to link them to all the things that they might need so that they can thrive and survive. 91% of our clients are virally suppressed. If you're not familiar with what viral suppression is, it's essentially, if you're virally suppressed, it means you're undetectable. So when you test for HIV, it is an undetectable viral load, which means if you're undetectable, you're not transmitting the virus to a partner. And that is making a world of difference because people are having loving, healthy relationships with partners and they're not passing the HIV along. So really, until there's a cure for HIV, viral suppression is the way that we can kind of curb the transmission. So about 66% of the national average is virally suppressed for people living with HIV. So the 91% again kind of proves that this wraparound collaborative care is working. Sorry, pardon me, I'm trying to get my notes back up. We also offer drug assistance. Most of our clients are on Medicaid. We're helping them navigate the healthcare system, making sure that there's no reason that they're not taking their meds. And so we've got incredible funding and grants to help cover that. Also with transportation assistance, we offer QT gas cards, we offer bus passes, we do Modus, which is another nonprofit that has volunteers that drive people to their medical appointments. We then do kind of Lyft and Uber and all the things. So we recognize that transportation can be a tremendous barrier to getting to your medical appointments. And it's not just your HIV care. There's a whole host of other kind of issues that stem from your HIV treatment. And so, dental care and things like that that we want to ensure that they're taken care of. Moving on to mental health. Clinical depression and high rates of suicidality are very common in this community, people living with HIV. There's a lot of shame, there's a lot of stigma, and I keep repeating the same messages, but this is just the reality that our clients are facing. I'm feeling very isolated, very scared. My life is over, what do I do? And we've got 2 therapists on staff. One is a trans woman, which is incredible to have that in our community to take care of clients that feel more comfortable with her. And then we're working through couples therapy. We've got group therapy, different ways that we can kind of support them. Of course, if they need psychiatric help, we can refer that out. But mental health is such a tremendous part of the work that we're doing, and making people understand that they are worthy, they're valued, they're important, and they're going to get through this. And so that is just it's kind of a beautiful transformation when people are entering into our mental health program and getting the support that they need there. We also have kind of a newer shift going out in the field. Our mental health team is talking to people who are maybe at the day center or Iron Gate, some of the nonprofits that are serving very at-risk people who might be living on the streets or have kind of they're couch surfing. And so with that comes, sometimes at risk or riskier behavior. And so we're talking to those people to just encourage them. Let's get tested. We've got a phlebotomist who can test in the field. And so we're really trying to just encourage people to not be afraid to get tested as well. So the mental health team can be there during testing if you did indeed test positive, and you've got kind of this instant person that can support you through a very scary time. Next up is housing. Housing is our largest program financially. We, in 2023, gave out over $600,000 in subsidies alone for mortgage, rent, utility assistance, deposits, furniture, moving, you name it, we kind of do that in the housing realm. And so obviously housing is healthcare. If we're not stably housed, it's very, very hard to take care of basic needs, and we recognize that. So there are actually federal dollars that support people living with HIV, and regardless of administration, that money has kind of never been really touched. And so that money gets funneled through the city and the county and comes to Tulsa CARES so that we can distribute those dollars and make sure that as many of our clients that need housing support receive it. We do operate that program under kind of a nondescript LLC because, again, stigma is still real, and if people know that the money's coming from Tulsa CARES, they're going to make that conclusion that the client might be living with HIV. And so we try and protect the client as best possible and operate under that LLC. So, so the landlords get paid and the tenants hopefully feel like they're kind of protected in that way. We also help people who may not be eligible for the financial subsidies locate housing and things like that, or navigate maybe a tenuous relationship with a landlord, or we're really trying to prevent evictions and giving people life skills again, like how to keep their unit clean and kind of make sure that maintenance is addressed and things like that. Again, things that you and I might take for granted. A lot of our clients don't have, again, those supports or the people that can kind of help them navigate that, and so our housing team will go in. We have very strict kind of guidelines on the kind of the cleanliness, and there's standards for kind of habitability. So all of our units have to pass that if we're giving clients financial support. So we're really trying to get them in places that they feel like can be home and help them get those homes furnished. We have like happy home packs that have all the basic essentials that if a client is maybe moving in from a hotel to housing, they have nothing. They literally have, kind of the clothes on their back and maybe a bag, and so we're getting them pots and pans and comforters and trash cans and all those things too. So really, I'm always amazed at the incredible things that we can do to kind of wrap our arms around these clients and take care of them in so many meaningful ways. Nutrition is up next, and this is such a fun program because who doesn't love to eat? And food is community, and we can bring our clients together for meals, and we've got a farmer's market on site 2 times a month. We have probably 30 different fruits and vegetables, bread, eggs, things like that, that a client can go self-select whatever they'd like. We have a registered dietitian on site, and so she's often doing demos with foods that maybe a client has never tried before, like, have you ever had a mango? Do you know how to cut a mango? How do you, what's a recipe you can prepare with a mango? Things like that. Again, these are like life skills. So our registered dietitian is just this breath of fresh air, and she's working with our clients on real issues related to their health, like lower sodium, or some of our clients need to gain weight, and so we're getting them on kind of diets so they're, kind of gaining healthy weight. And so she's got kind of these meal plans and one-on-one guidance on how to navigate that. She also can prescribe different vitamins and supplements and things like that. We also have an on-site market. It's a mini grocery store. We do take donations, but we actually have funding to go buy consistent dry goods and meats and cheeses and things like that, frozen foods. And so it is, when you go in, the shelves are consistent with the same canned good or whatever, or the box of rice or whatever that is. So again, it feels a little bit more like a grocery store. There's pricing on all the things. So we're also training our clients how to budget appropriately. It is all free, but they do have a budget that they're having to work within. And so they go like check out and kind of see what the things cost, and then they might have to put something back. But again, it's back to those life skills. And there's dignity in them self-selecting that food. We have an emergency food pack that's the same thing. So oftentimes, and not to disparage, when you get a bag of groceries, if you're hungry, that's wonderful. But if you're hungry and you need emergency food at Tulsa CARES, you're going to get a piece of paper with everything that we have in our pantry, and you get to self-select what your family needs. And so again, just trying to eliminate waste, trying to give dignity and choice. And it's just it's a wonderful program because, again, just food kind of is so universal and brings us together. And so we've got communal meals and things like that. We used to have more regular meals. COVID, like a lot of communities, it kind of changed the trajectory of some of the ways people are bouncing back. And so we're seeing people slower to want to join into those things as well. And the isolation really did. We kind of took a hit with our client population. But we're working through that, and we have client events. We have a holiday party that we hosted at All Souls last year, and we've got a June event that's kind of an Earth Day theme, and getting folks engaged in recycling and just things that maybe are kind of outside of their general purview every day. And so really, again, just trying to give them purpose and community. So the nutrition program, it's probably one of my favorites just because it's special. And I do see 138,000 pounds of produce and food distributed last year alone. So lots of food. So hepatitis C, as I mentioned earlier, we piloted this program in 2018. Hepatitis C is certainly, it's a different population, of course, than our clients living with HIV, but it is still a highly stigmatized population, disproportionately impacted communities. Often minority populations have a higher rate of hepatitis C. And we recognize that those that are often underserved, are getting these diseases at a higher rate than those that have affluence or are living in white suburban neighborhoods. And so we do the best job of kind of targeting the people that need the most help and have maybe the fewest resources. And so hepatitis C, as you may know, like baby boomers were kind of the at-risk population. Now today, those most at risk are people who are injecting drugs. And there's a very high prevalence of Hep C in the prison population. A lot of that is illegal tattooing and things like that. So this is a bloodborne illness, but it is curable now. And so the treatment, when it first came out, was very, very painful. It was very, very expensive. Through treatment advancements, things are getting a lot easier. You can be cured of hepatitis C in 8 to 12 weeks. Which is incredible. It's still very expensive, but we're helping our clients navigate that. And we never want expense of treatment to be a burden or a barrier to care. And so we are bringing people in. We're recruiting from the street. We're going to transitional living facilities, so people exiting justice involvement and they're transitioning into kind of the real world. Those are obviously at-risk people. We're going into drug treatment facilities to test and get people recruited into the program. We're going to methadone clinics. Our phlebotomist sometimes is working with sex workers and kind of out on the streets and in the field. And so we're really trying to put ourselves out there to just, again, wrap our arms around people that may feel like nobody cares about them. And we want to get them tested and treated as quickly as possible and help them navigate something that within a matter of months they're cured. And so in that kind of model of care, while these clients are with us far shorter term, they still have access to all the programs that I just referenced earlier. So we're helping them kind of get back on their feet. And if they need to stay with us a little bit longer, we can happily accommodate that. But for the most part, we're kind of cycling those clients in and out pretty quickly. So in 2021, we brought on medical services. So that was kind of the one component that we weren't doing, and we weren't quite ready to bring on medical. But we had a physician on our staff who's an HIV specialist. She came to us and she said, I love what I'm doing, but I'm in this big health system, and I would love to work for Tulsa CARES. And we had kind of been thinking through, like, wouldn't it be great if we could get medical? And so we were able to bring her on in a part-time role. She's with us 25 hours a week right now. But what you see behind me is the rendering of a medical clinic that we're breaking ground on in a couple of months. And it'll open next year about this time. And so this medical clinic, what I love about it is we'll prioritize our clients and give them greater space for not just their HIV or Hep C care, but primary care and things like that. But it's also going to be open to the community. It's going to be LGBT-friendly primary care. We have another part-time nurse practitioner that we've just brought on, and these will all kind of transition into full-time roles once the clinic opens. We'll be focused on STI treatment and testing, and we'll have a pharmacy on site. We'll have a lab on site. We certainly can't do it all. We're not going to be a big health system. This is only 4,000 square feet. But for people that want kind of a friendly, easy place to come get their care, this might be a great solution. And so we're really, really excited. The best part is this is next door to our current building. And so you can kind of see in the rendering that little building right there is our existing building. And so it'll just kind of be a seamless campus, if you will. We'll have a green space in between connecting the two. And we're just really excited to see kind of what the next generation of Tulsa CARES looks like for our community and giving them care. And I just wanted to, I'll try and read it this way. Oh, actually, I've got it right here. This is a note from our client. This is Bruce. I'm not supposed to have favorites, but he might be one of my favorite clients. But he shared this, and I just felt like, we don't get to show pictures of a lot of our clients, or it's hard to story tell about our clients, but he wrote this and sent this to me, and I just thought it was really beautiful. And he says, benefactors, people who do good things. It takes many of you to keep Tulsa CARES running, offering help to me and hundreds of others like me in Northeast Oklahoma. This year I used the in-house medical clinic, was guided through accessing government housing, healthcare and food resources, got direct help paying gas and prescription expenses, enjoyed a constant supply of fresh, healthy, my notes got cut off, sorry, first quality fruits and vegetables, and was welcomed to a renewed community in the second cup lunches. To each of you who gave up something in your life so I could have something in mine, thank you. It made a difference. You made a difference. And it's just, this is the sentiment of a lot of our clients. They are so unbelievably grateful. They come from all walks of life, especially our older clients. A lot of them, Bruce included, highly educated, had a great career, and then HIV hit and this kind of world shattered. And now he lives a very kind of meek and humble life. He's obviously still an incredible man, but his whole kind of world changed. And so he's so reliant on Tulsa CARES and recognizes kind of what he had and how grateful he is for Tulsa CARES today, because a lot of his community changed. And as all you remember, in the 90s, people stopped working. They went on disability. This younger generation, we're trying to keep them educated and getting jobs because they're living, healthier lives. But the vast majority of our client population today is over 50. More than half is over 50. And so we're now dealing with kind of this new, it's a great problem to have, right? Because you've got people living with HIV over 50, but nobody's dealt with this population before. We're all kind of figuring it out together. There are additional health risks and things associated with it, but we're learning kind of how to deal with the aging population, the aging HIV population. And so clients like Bruce, he warms my heart, and it makes me incredibly grateful to a community like yours that recognizes the value in Tulsa CARES. Not all churches would welcome me today to talk about this work and to give of your time and resources to support our agency. So I am incredibly grateful for that. And I'm going to just